Good evening to you, Minister. Thank you very much for your time. I think to kick us off in this conversation, the theme for this year is quite telling that's been adopted by the government, and it says, and I quote, "Overcoming disruption, transforming the AIDS response." How big a disruptor has the cut in funding, particularly from international donors, whether you talk about the United States government, how big an impact has that had in the fight against HIV/AIDS?
Good evening, colleague. Good evening to the viewers and listeners of Newzroom. Let me correct a little bit, Chloe. The theme you have mentioned is not a theme that was adopted by South Africa.
Right.
It's a global theme. There is a theme globally that is talking about overcoming disruptions. The theme we have adopted in South Africa is renewed efforts and sustainable commitment to end AIDS. That is our theme. But as you have already said, globally, the theme is talking about overcoming disruption. It just shows that disruption did not affect South Africa. This is affecting the global citizen.
Thank you very much, Minister, for that correction. In fact, quite important. Let's nonetheless continue with this theme of disruption. You listen to some of the keynote speakers that would have spoken in the various provinces today as we mark World AIDS Day. The mayor of Ekurhuleni, Mr. Xhakaza, quoted as having said, "We have come too far to allow disruption to reverse progress." How big has this had? How big an impact has this had in South Africa, these disruptions? Because I remember a time when government was stressing that, yes, indeed, the funding coming from the US played an important part in some of the programs or projects that are being run in South Africa, but it really hasn't been that big an impact in terms of reversing the progress that's been made in fighting HIV/AIDS. Am I correct in that assumption?
Yeah, it depends who you are listening to, Oli, and who lost what. So it's not really uniform about whether the disruption, but I'll give you facts. You will make up your mind from the facts I'm going to give you, whether the disruption in your mind has been big or small. The first thing is that PEPFAR was helping us in 27 districts out of 54. So the districts that were affected were 27 in 8 provinces, which means one of our provinces, which is Northern Cape, was not affected at all. And which means 27 other districts were also not affected. That's number one. Number two, PEPFAR, the money from PEPFAR was coming in 2 forms. It was coming from US aid and an American Center for Disease Control, CDC.
Yes.
Now, the money that was stopped immediately was from US aid, which means it affected at least half of what we're having, because the money from CDC continued. It was supposed to stop in September. If you remember, they extended it by 2 billion rand until March. So in that case, there was no disruption. But the third thing I want to mention, the ARVs that were are consumed by 6 million South Africans. None of them were bought from PEPFAR money. 90% of all the ARVs, we were buying them from our own fiscus. Our own treasury was funding that, and the remaining 10% was funded by Global Fund, which you know is not PEPFAR. It's a global organization that was formed about 24 years ago, specifically to fight AIDS, HIV, and TB. And every 3 years, the Global Fund meet to do what is called replenishment. And the replenishment round this time around happened to be in South Africa. It happened on the 21st of November, just a day before the global leaders met under G20, and they chose South Africa in order for it to coincide with G20, and funds were raised there. So the affected, the main area where I could see were affected, as far as are concerned from government, are mostly people who were hired by PEPFAR money. And as I said before, the number of people who were in these 27 districts were 266,000 people who were working on HIV and AIDS. And 15,000 of them were paid by PEPFAR. And when they stopped US aid money, it affected half of them, about 7,000. So those are the ones who were very heavily affected.
Two critical questions, Minister, before I let you go. Deep inequalities in South Africa are well documented. I don't need for us to revisit that conversation. However, in relation to the fight against HIV/AIDS, there is a particular grouping that constantly is said to be vulnerable, and these are adolescent girls and young women. Where are we in trying to drive the message of not only prevention for those that haven't been infected, but those that are infected, ensuring that they take the treatment so that we prevent the spread of this pandemic?
Indeed, Xoli, the issue of gross inequality in South Africa is well documented around the whole world. That's why we're coming to very strongly on the issue of universal health coverage to end gross inequalities in health. If you want to see what we mean by inequality in South Africa, come to the health sector. You'll see it alive and kicking. And that's why we wanted to come with universal health coverage, which we call NHI. Coming to young girls, it is true that they were the biggest victims. Now, in order to remember, Oli, when we adopted the theme of renewed efforts and sustainable commitment to end HIV and AIDS, we are not just saying it. We have got programs. The first program that we adopted, which I launched in Bloemfontein, in Mangaung, 3 weeks ago, is called 6MMD, 6 multi-month dispensing, where we give you ARVs for the whole 6 months, no longer for a month or for 3 months, but for the whole 6 months, so that you are always compliant, you are always having ARVs. You can only go to the clinic twice a month. The second program is what we launched on the 25th of February, which is called 1.1 million, Closing the Gap, where we are looking for 1.1 million people who we know are HIV positive but are not on ARVs. We have been looking for them from February, bring them back to treatment so that we reach our 95, 95, 95. The third program, which we think is going to be a game changer, will help us specifically on adolescent girls and young women, is the new injection called lenacapavir. I'm sure we have spoken about it before.
Indeed.
Lenacapavir being an injection, yes, that we are hoping to launch in March or April next year, but the first quarter of the year, which is an injection that you take only twice a year, every 6 months. And investigations, research, and trials have shown that as long as you take it every 6 months, if you are a young girl, an adolescent girl and a young woman, you are 100% protected from HIV and AIDS. So while we are encouraging people who are HIV positive to take ARVs, lenacapavir is specifically for those who are HIV negative, to keep them negative forever.
Yeah. You've already answered that question I was going to ask you, Minister, because it had to do with exactly the game changer you speak about, lenacapavir. My pronunciation of it is going to improve, I promise.
It's perfect. It's perfect. lenacapavir. Lenacapavir, yes.
Right.
It's perfect.
So here's my final question then. The United States and the the continued tensions, diplomatic tensions, if you want to be precise. Pretoria is not seeing eye to eye with Washington at the moment. Do you fear that this is going to worsen the situation? How dependent South Africa is really on the US's funding programs such as HIV/AIDS?
Well, I think maybe it will be much fairer to say how dependent is the world on America, because it definitely was and is something that is a learning curve. I think we have learned our lesson, because remember why I'm saying the whole world, not only South Africa. Remember, PEPFAR was not only funding in South Africa, it was funding the whole world for the past 2 decades. But it was also funding UNAIDS, World Health Organization, etc. And it has withdrawn from all those organizations globally. Now, so it's not only South Africa, it's the whole world. That is why, Koli, last week, or on the 21st of November rather, when there was a global fund replenishment, we were trying to mobilize the countries that, look, the global fund is the only fund that is left because America has taken its PEPFAR. So we're encouraging countries, businesses, and individuals to donate as much as possible. But because US is very unpredictable, I need to tell you something. During the replenishment round, when we met in Sandton with all these countries pledging, I'm sure you are aware that we collected a total of 11.3 billion American dollars. I'm sure you heard that. What you might not have heard is that 4.6 billion of that came from the US itself. They did not come, but they sent a video and said they want to pledge. They sent a young person. They always send young people at us. I mean, most of the time, if they come to a meeting, they send the young people who are very rude and old and spoiled. They sent this young chap who insulted all of us. Remember, there were heads of states there. There were leaders of government who told us how America is the only country that can save the world, that is the only country that is generous, that even if countries don't agree with it, etc. He even mentioned that organizations don't agree with them suffer. And he mentioned the World Health Organization and UNESCO, how I'm sure you know UNESCO,
Indeed.
United Nations,
Yes.
scientific and education, scientific and cultural organization. He mentioned specifically that they suffered because they're trying to undermine America. The World Organization has also suffered. After telling us that, he was telling us actually to get off. After telling us that, he then said America is pledging 4.6 billion American dollars. That was the highest amount of any country or any organization. Don't you think that is funny?
Very funny, and as you correctly characterized it, Minister, very unpredictable as well. And so the world will continue, I suppose, to be at the mercy of the big brother, America. Thank you very much, Minister of Health, Dr. Aaron Motsoaledi. Always a pleasure talking to you.